And we are back on Saturday mornings on WHP 580, Michael Parks, and we are taking care of business, taking care of our local businesses, spotlighting them and showcasing them, learning all about them, and focusing on our small businesses. In fact, this weekend is Small Business Saturday that we and all of our Clear Channel radio stations have teamed up with at American Express, where it's the idea of shopping local and supporting our local businesses because the money you spend locally stays here right in our neighborhood. A lot of the businesses we feature on Taking Care of Business, not only do they sell products, but they sell services. And these folks have been with us pretty much from the start that we started the program with Taking Care of Business. It is the fine folks at CPRS Physical Therapy with locations throughout the entire region. And today we're going to talk about how their wellness program is helping folks with diabetes because it is Diabetes Awareness Month throughout the month of November. And today we are broadcasting from the Lancaster area of the heart of Lancaster Medical Center in Lidditz. And we're going to be talking with some folks from Cornerstone Family Health, talk about diabetes, and also Jerry Rush, who from CPRS, to talk about how CPRS and their wellness program is helping folks with diabetes and manage it. Also joining us, our good friend Francesca Kirk from CPRS. So let's start out a little bit about and just tell little folks about CPRS, who you are and what you do.
Sure. CPRS Physical Therapy started in 1983, so we're celebrating 30 years this year, which is very exciting for us. And our company started with a husband and wife physical therapist, and since 1983, we've grown to 26 locations throughout Central PA. And
of course, you do so much, whether somebody is injured on the job, that kind of physical therapy. But again, what we're going to be talking today is about wellness. So explain to us what wellness is.
Oh, what a big question. We, in all of our locations, have wellness centers. And so our wellness centers offer a variety of different programs, from just a general membership to personal training to a healthy lifestyles program, which is a 3-month individualized program for patients, focusing on specific disease, focusing on specific goals that they want to achieve. And so any person can come into our wellness center. It's a medically focused gym, so anyone that comes in is supervised by our exercise physiologist or a physical therapist.
Because the whole thing comes down to whether you're injured or else whether you're dealing with an injury. The whole problem is, and the solution to so many medical problems is keeping well, keeping fit, keeping healthy, because the more you are that way, not only is it physical, but it's also mentally, and you live a healthier lifestyle, and that's where CPRS comes in, is to make you happy and healthy. As I mentioned, November is Diabetes Awareness Month, and we were talking last week with the folks from Pinnacle Health to talk about how they are working with folks with diabetes and what a serious dilemma and problem it is. Joining us now is Christie Gehman. Christie is a registered dietitian with Cornerstone Family Health, which is pretty close to where we are right now in Lidditz at the heart of Lancaster Medical Center. So, Christie, I want you to probably just talk again about diabetes. We hear about it, but we don't hear as much about it. We hear about all the other things, heart disease, cancer, and so much more. But diabetes continues to be a serious problem affecting a lot of people.
Good morning. Diabetes is a chronic disease, and it requires a lot of complex care, self-care behavior. And basically, there are 2 types of diabetes, type 1 and type 2. And the main difference between them is that type 2 is something that progresses over time, meaning that a person is not going to have as much insulin production over time and require more medication. And type 1 means that you have absolutely no insulin. And so you immediately do require insulin injections.
All right. If you can, maybe just, could you put into words like what diabetes is? Again, I've read about it and heard about it and talked to so many people about diabetes, but it has to do with your blood, correct?
Well, diabetes basically means you are either have absolutely no insulin or you are having insulin production that is slowing down over time. So that means that your body is requiring more insulin to help metabolize or manage the sugar or the glucose that you're putting in it from the food that you eat. Right. And so that is managed either by lifestyle, which is diet and exercise, and long-term by medications.
So we'll do medicine 101. So people consume food. Food has sugar. Food has sugar in it. Yeah. Our body, particularly the blood, if it gets too much sugar, it produces insulin. And then this insulin controls the sugar, because if we get too much sugar in our system, that's bad, and that's when you are really diabetic.
When you have too much sugar or glucose in your bloodstream or in your body, that's when the damage can occur from diabetes. So that's when that sugar is circulating throughout your body and damage is being caused in your blood vessels and in your organs and your eyes, and those would be the complications that can result from diabetes. But if we back up and talk about prediabetes, and this would be specific to type 2 diabetes. Again, if we take type 1 diabetes out of this, because type 1 is diagnosed immediately, and that is absolutely no insulin production. But with type 2 diabetes, there is a condition called prediabetes, and that's when you have some lab values that are elevated, and you have the opportunity at that point to do lifestyle intervention. So some healthy eating and exercise is going to help to reduce your risk of developing type 2 diabetes.
And that's what happens like when you go for your annual exam. Like say at Cornerstone Family Health, you would get your blood test, a doctor would take a blood test, and that would tell the doctor if there's a problem with you, and then the doctor would come in, consult with you and say, hey, these levels are a little high, you're prediabetes, we need to do something about it. And then we want to prevent that, because as it elevates and goes on further, as you mentioned, it could affect other organs in your body and eventually really, really become serious. So one of the things that you talk about is lifestyle intervention, because from what I understand is that a lot of times what leads to diabetes is just not being healthy, like overweight, not activity. Is that the thing?
What can lead to diabetes, it can be some of those things. It also, a large percentage of it is also hereditary. So environment and family genes are going to be contributing to someone's risk of developing type 2 diabetes, also type 1. But you have the ability to reduce your risk of developing type 2 diabetes by lifestyle intervention again. And so eating healthy and exercise contribute greatly to reducing that risk.
Which is your expertise at Cornerstone Family Health, because you're a registered dietitian, so it ends up with a meal problem. All right, what are we eating bad, and what should we eat well if we are pre-diabetes or even level 2?
Right. So we do talk with patients about how they can make a diabetes meal plan, which really amounts to healthy eating. It really mirrors healthy eating, with the exception of maybe focusing more on carbs and people testing their blood sugars. So testing their blood sugars would be the other component of that, to really quantify how their body is responding to the food that they're eating. But it really is healthy eating, and it's about whole grains and plant protein and those vegetables, and we do talk a lot about the plate method.
What's the bad stuff?
Typically, we talk most about the trans fats, so those saturated fat and calories, as being the biggest culprits. Weight management is something we spend a lot of time talking about, because by reducing even 5% of your body weight, that will improve your body's sensitivity to insulin.
Now, the other thing that you talk about, and what I've heard from people who are diabetic when they go on these programs, they always fear for the worst. Oh, I'll be able to eat anything, it's horrible. But the actual recipes and meals that people eat that you recommend aren't really that bad.
We provide a lot of recipes based on the patient's just likes and their time frames and just what they're interested in, and their preferences in cooking, and work with that. And so it may not be that it's, in quotes, healthy eating, but it is definitely moving forward from where they had been eating. So trying to go from where the patient is at and moving forward with where they're ready to make changes. So it could be small changes, but trying to provide them with things that are realistic and economical that can be part of their life.
We're speaking with Christie Gehman. She's a registered dietitian with Cornerstone Family Health, and also Jerry Rush and Francesca Kirk from CPRS Physical Therapy. CPRS, the folks at CPRS, with their wellness program, are helping people with diabetes to get back in shape, stay in shape, live a healthier lifestyle. And we're going to talk to Jerry about that, like how they actually have specific programs for diabetics to help them with that. Technology has really helped out with folks with diabetes and in your field. Talk about that quickly.
Well, I just said a baseline, making home blood glucose monitors much more accessible to everybody and much more user-friendly, so that people are able to test their blood sugars and have a better sense of where their numbers are at. Knowing your numbers is crucial in managing diabetes. And secondly, in terms of managing diabetes with insulin pumps, that has become very popular in type 2 diabetes, as well as what we would have once thought of pumps in only type 1. So we use a lot of pumps in type 2, the type 2 diabetic population. And certainly the continuous glucose monitoring, which is something that is placed for 3 days and then is able to register blood sugars every 5 minutes, gives physicians a very good idea of how blood sugars are behaving over a 24 to 48 hour period.
All right, let's go into the importance of wellness and physical activity when it comes to diabetics. Pre-diabetes, when you develop with it, or else, the different levels of diabetes, type 1, type 2 diabetes, the importance of wellness.
Wellness provides patients with that window of opportunity to be able to make lifestyle changes and minimize the risk of developing diabetes. So both with healthy eating and developing an exercise plan can be very beneficial. So Jerry is able to provide patients with a exercise routine and discuss with them what is appropriate with a chronic illness like diabetes. There are specific things for that disease state that would not be appropriate in just an average gym.
All right, let's talk to Jerry. One of the things that we talk about when it comes to CPRS is the importance of wellness. And well, first of all, let's talk about your wellness program totally, because we think of CPRS, we think of physical rehabilitation, helping people when they're injured, but wellness has become an integral part of CPRS.
Sure, it has, Michael. We're certainly known for the physical therapy and athletic training services that we have, but wellness is becoming a bigger and bigger portion of our business, and there's a lot more public demand for wellness services. Specifically, in all of our locations, we have wellness services available. Our wellness services have a few different components. One program is we just call a general wellness program. It's open to the public. You can look at it as a public gym membership. The difference with that is all of our centers are either staffed by exercise physiologists with a 4-year degree, a licensed physical therapist, or a licensed physical therapist assistant. Another level to that is we have a program called Healthy Lifestyles. That program is specifically designed to manage certain disease processes in people. With that, it has a 3-month general wellness membership. It includes baseline testing on the first day that you're there. We sit down with the individual to hear their wellness goals, their exercise goals, review their past medical history, set them up on a personalized exercise prescription specific to any disease process they have going on. And we're able to set them up on our program that they continue for a month, and then they get baseline testing again in the next 2 months to see their progress, and really holds them accountable and gives them some goals to strive for.
And that, I think that's the important part, and we always talk about with CPRS is the idea of direct access. With Christie, a lot of the patients will come to their practice and recommend that they improve their physical activity, work in a wellness program. But as you were saying right there, this could be like pretty much anything, not only diabetics or anybody else who just wants to improve their lifestyle. They can come to CPRS, consult with your staff and find out how you can help them.
That's true. With wellness, it's completely open to the public. There's no referral needed, although we do take some referrals from physicians to wellness as well. But it is something that's open to the public. And again, our centers are staffed by highly trained individuals. So there's a difference of level of care and knowledge base there versus a public gym you may join.
Yeah. When we're going to take a break, and when we come back, we're going to talk about how your staff and your programs at CPRS works with someone with diabetes, and the importance, again, why exercise is so important, the safety considerations, and also, are diabetics more prone to certain types of injuries? We are with Jerry Rush, Francesca Kirk from CPRS Physical Therapy. We're learning about It's Diabetes Awareness Month. And we're learning about if you have diabetes, pre-diabetes, the importance of wellness and how CPRS can help you. Learn more about any of their facilities, how you can reach them by going to cprsweb.com. You find out all about their locations and their contact information. And also joining us is Christie Gehman from Cornerstone Family Health in Lidditz, and how they're helping their patients who are diabetics. She's a registered dietitian, and helping them and people deal with this problem during Diabetes Awareness Month. All the contact information. Hear this interview again on our website at WHP580.com. Click on Air, the Michael Parks. We will continue in a bit. We are taking care of business on Saturday mornings on WHP. Taking care of business Saturday mornings, WHP 580, Michael Parks, along with Christie Gehman, registered dietitian from Cornerstone Family Health. Their website, cornerstonefamilyhealth.net. Also, Francesca Kirk, and also Jerry Rush from CPRS Physical Therapy. In fact, we're broadcasting from the heart of Lancaster Medical Center, CPRS, Cornerstone Family Health, all in this general area today. Jerry, let's again talk. It's Diabetes Awareness Month. We're talking about the importance of diabetes if you're diagnosed with prediabetes or type 1, type 2 diabetes, the importance of exercise for someone with diabetes.
Sure, and I think it's also important to state, as Christy stated, that exercise is just one component to manage diabetes, and it's important really to be, to have that care managed and to be linked up with someone like Christy, who's a certified diabetes educator, to have that full management of diabetes. But exercise can play an important role for that. And there's several ways that exercise comes into play to really be beneficial for people with diabetes. Specifically, it can improve overall cardiovascular health and circulation. That can be an issue with the diabetic population. And it can also improve insulin binding or sensitivity. Why that's important is that can actually can lower some insulin requirements, or why it's important with exercise is that can change your insulin regimen while you're exercising or being active. So it's something to really keep in mind when someone's exercising. Some other benefits, it does increase carbohydrate metabolism, and also can help with weight reduction and improve your lipid profile. So there's some basic lifestyle modifications that can benefit not just population, but in general.
We were talking about how CPRS, are trained. The folks here are the best of the best. They're very well trained in pretty much anything that they do and anything they offer. And Jerry was pointing out the fact that with their wellness program, they have a lot of people who are trained specifically to help people with certain diseases and illnesses. I would assume there are some safety considerations that one must take when you're exercising with diabetes.
Sure, and it's something that we always tell people to consult with a qualified healthcare professional prior to starting a program for this specific reason. But with people with diabetes, you can have some specific things to look for. One of those is with exercise, it can actually decrease your blood sugar levels to a dangerous level, or it can increase them. So it's something that you need to be able to monitor and have some education and advice on how to manage those sugar levels during exercise or prior and afterwards as well. There's also some increased cardiovascular risk with this patient population. So there's some more stringent guidelines to look at as far as setting up exercise programs and staying on top of them versus just, here's a gym, go in and work out. You really need to have some assessment, some guidance, and some monitoring along that way. Just a few things to keep in mind.
All right, as we wrap things up, again, Christy, diabetes, you can be diagnosed with it, but it can be treated. It's not it's serious, but there is help, and you can make some changes to help you deal with the disease.
Absolutely, and diabetes, while it is a chronic illness, is one of the most manageable diseases. And I think one of the things I would leave you with is that it's most important should be with a physician or group of physicians that have a knowledge base of diabetes and can coordinate care so that they're able to refer to a dietitian or an organization like CPRS, where and eye doctors and all the care that is required for management of diabetes.
And as we wrap the thing too, one of the importance of dealing with managing diabetes is getting in shape, exercising well, and this is where the CPRS wellness program comes in.
It does, and again, it can be an important part, and it's something that our wellness centers, they're medically oriented gyms, so it's not a traditional public gym setting. Again, there's exercise physiologists or licensed physical therapists or licensed physical therapy assistants running these programs and managing these programs. So it's a comfortable, safe environment. It's not a typical gym environment, and there's a lot more medical management of the processes that we see with people. All
right. Well, it's some good news. Again, November is National Diabetes Awareness Month. Be aware, again, visit your family doctor. Get the blood test done. Don't ignore it. There is help for you, and it's you have to change some things in your life, but pretty much a lot of us do these things too. The most important part is staying healthy, staying happy, and being there for your family and your friends. Learn more about Cornerstone Family Health. We are down at the location at the heart of Lancaster Regional Medical Center. Cornerstone Family Health is the website, cornerstonefamilyhealth.net. CPRS Physical Therapy. There are locations throughout the entire region, and there's a location nearest you. Learn more about them by going to their website, cprsweb.com. Hear the interview, all the contact information on our website, whp580.com. Click on Honor, then Michael Parks. We are pretty much done for this time. Stick around. Medical Matters is coming up next, followed by the Plant Doctor, and I will talk with you next Saturday morning at 7. I'm Michael Parks, and we are taking care of business on Saturday mornings on WHP.